When I grew up, we didn't have anybody in our family that was a physician. In high school, I made the decision that I wanted to be a doctor. I really didn't have any specific role models, or it just seemed like it was very interesting. I've always been fascinated by the body and how it functions and what can go wrong and how to keep it going right. Primary care is by definition relational, and that's one of the things that attracted me to it. You really get to know people. It's important that when patients come to see me, that they are comfortable telling me what they need to tell me. And I hope and expect that I make it comfortable for them to let me know what they're worried about. I place a high premium on communication, and it starts with listening. You need to listen to the patient and try to understand what they're telling you and understand what they're concerned about, what their worries are. And then I try to explain to them in terms that they can understand about what's happening to them. I really want patients to be as informed and engaged and educated about their condition as they want to be. Internal medicine doctors are trained to make complex medical decisions and to diagnose complex conditions. And so I would think that maybe a good internist could be able to take care of 80+% of what walks through the door. We're fortunate here at Bozeman Health to have really good medical specialists that we can refer patients to. Because internal medicine and primary care is so relational, many times patients will feel either intimidated or they'll be so focused on what the specialist is saying that they may forget to ask a question or two, or they may not understand it, or they may want to know where to get more information about this. And that's where I think we can really come in handy. I'm somebody who is going to go to bat for them if they can't get a med covered, or can't get a procedure covered, or can't get in to see somebody for 6+ months. I always look at patients as, how would I want to be treated? If I were in their shoes, would waiting 6 months for something I'm worried about today be acceptable? And so I really try to advocate hard for people. And I'm not afraid to tell people when I don't know something. So I try to be as honest and transparent as I can as well.